Hello my friends, welcome back to my channel. Jamaica's medical system is under threat. Will Jamaicans cut ties with Cuba, the Cuban medical program for a US visa? You heard me right. Will Jamaica cut ties with the Cuban medical program in order for their leaders to keep a US visa? In this video, I will explain to you why Jamaica's medical system is under threat by the United States of America, and will Jamaica cut ties with America in order to keep their visa. We know several weeks ago Donald Trump made some threats to Caribbean leaders and also African leaders who use the Cuban medical program. Donald Trump demanded that these countries who use the Cuban medical program should cut ties with Cuba, or their leaders and the family members of the leaders would face their US visas being revoked or banned from getting a US visa. The Caribbean leaders CARICOM met a few days ago to discuss this very same situation. However, we haven't heard anything back from them yet. CARICOM, the Caribbean leaders, supposed to meet with the Secretary of State Marco Rubio this week coming to discuss the Cuban medical program and ways in which it benefits the Caribbean nation islands, and how we in the Caribbean depend heavily on the Cuban medical program to help us. Now I will explain to you exactly what is happening in Jamaica and why they depend so much on the Cuban medical program and the risk involved in losing it. So will the leaders take a risk in losing the Cuban medical program that is used to save so much lives in Jamaica and bolster their medical system in order to just keep a US visa? As of March 23rd, 2025, Jamaica continues to participate in the Cuban medical program, which has been an integral to its healthcare system for decades. However, recent policy changes by the United States have introduced visa restrictions targeting officials from countries that engage with the Cuban healthcare workers, labeling Cuba's medical missions as forced labor. Yes, recent restrictions targeting officials from countries that engage in the Cuban healthcare workers, labeling Cuba's medical missions as forced labor. In response to Jamaica's request to cut ties, the Jamaica's Foreign Minister of Foreign Affairs and Trade, Senator Kamina Johnson-Smith, expressed concerns over the potential implications of the US policy and indicated that the government is seeking clarification on the matter. Additionally, Healthcare and Wellness Minister Dr. Christopher Tufton acknowledges that the policy could significantly impact Jamaica's healthcare services. You heard that? As over 400 Cuban medical professionals currently operate in Jamaica. The ministry is proactively developing contingency plans, including exploring partnership with countries like the Philippines, India, and Nigeria to supplement healthcare staffing if necessary. While the US policy imposed potential challenges, there has been no official indication from the Jamaican government about terminating the Cuban medical program in exchange for US visa considerations. The situation remains fluid with ongoing discussions and assessments to determine the best course of action that aligns with Jamaica's healthcare needs and diplomatic relations. My friends, you must be asking yourself a question. What exactly does Jamaica get from Cuba in the assistance that Cuba provides to Jamaica? And I must say to you, my friends, it is significant help Jamaica gets from Cuba. And I will let you know what exactly this help is right now. Jamaica receives significant medical assistance from Cuba through a long-standing cooperation agreement. Some key aspects of this assistance includes Cuban medical brigades. Cuba sends doctors, nurses, and other healthcare professionals to Jamaican hospitals, clinics, especially in undeserved areas, far out in the countryside, hard to reach areas. Cuban medical doctors are trained for villages and harsh conditions, so they send the doctors all the way throughout Jamaica, including hillside, the countryside, all over, my friends. Medical training for Jamaica. Cuba provides significant medical training for Jamaica. Many Jamaican students receive scholarships to study medicine in Cuba, particularly at the Latin American School of Medicine, ILAM. These students return to Jamaica as doctors, boosting the local healthcare workforce. Specialist medical services. Cuba provides specialist medical services for Jamaica. Cuba provides specialized medical services such as eye care under the, this is a Spanish word, this is the word, they provide health care, eye specialist services under the Operation Milagro, Operation Miracle, that is the Spanish name, Operation Miracle program, which offers free eye care surgeries for Jamaicans suffering from cataracts and other vision problems. You heard that? Cuba provides free surgery and eye care services to Jamaicans who suffer from eye problems. This is a significant thing that Cuba is doing. Affordable pharmaceuticals, medicine for your illnesses. Cuba makes medicine. Do you believe it? As much as the embargo, I have embargo and sanctions on Cuba for over 50 years, Cuba is still able to make medicine. And Cuba provides cheap medicine to Jamaicans and the other Caribbean nation islands. Jamaica sometimes sources low-cost medicine and vaccines from Cuba, which helps reduce healthcare costs. Cuba provides vaccines, technical assistance and collaboration. Cuban healthcare experts assist Jamaica with disease control, public health initiatives, and medical research. This cooperation has been ongoing for decades and plays a vital role in strengthening Jamaica's healthcare system. My friends, this is no joke, my friends. You have heard me right. I have just mentioned the benefits that Jamaica gets from Cuba. So will the Jamaican government dump all of this healthcare benefits just so that they can get a US visa, so that they can travel to the US, stay in the finest hotels, do the shopping that they like, see the big tall buildings in America, and live in luxury? Will they abandon the Jamaican people, the health care services that Cuba provides, the eye care, the free eye care, the free pharmaceuticals, the free visas, not visas, free scholarships that Jamaicans go to Cuba to study to be doctors? All of this will be scrapped if Jamaica decides to dump the Cuban medical program. All of that they will lose. And what will the United States of America provide to Jamaica? They will provide doctors and medicine for a lot of money. Jamaica will have to buy medicine from America for a lot of money, and they will have to get American doctors and pay them tens of thousands. You know how expensive healthcare is in America. They will have to pay that same. American doctors are rich, because they get paid a lot of money. Can Jamaicans afford to pay American doctors in replacement for Cuban doctors? And will the healthcare services that Jamaica source outside be of a higher quality than Cuba? I doubt it. We haven't heard the Prime Minister Andrew Holiness come out and say that he supports Cuba. He hasn't said anything as yet. We have heard something from the Foreign Minister of Jamaica, but we need to hear the Prime Minister, the Honorable Andrew Holiness. We need you to come out and let us know if Jamaica will dump all of the Cuban medical benefits for a US visa. If you're watching for the first time, my friends, subscribe to the channel. Like this video, share it with all your friends and family. Comment your thoughts and opinion, and let me know what you think about this topic of Jamaica's medical system being under threat by Donald Trump and Marco Rubio's policy of scrapping the Cuban medical program, or making threats to the Caribbean to scrap the Cuban medical program in order for them to keep their US visas. That is all America has to offer, it seems like. A visa, something that you have to pay money for. And you have to pay to go to America and spend money with them. They're not giving anything free, my friends. So will Jamaica get rid of all of that just for a US visa? Let me know your thoughts and opinion on if you're watching from Jamaica, or you're watching from the Caribbean nation islands, you're watching from the UK, the US, Canada, Africa. Let us know if you think that Jamaica will dump the Cuban medical program for a US visa. And I understand Italy in Europe and Portugal in Europe uses Cuba's medical program. So will they, those two European countries, Italy and Portugal, dump the Cuban medical program in order to keep their US visas still? They don't need no US visa to travel to America. They can go visa free. So is this visa policy apply to Europe, or just the black countries like the Caribbean nation islands and Africa? We know Cuba would have stepped up during the pandemic and sent medical missions all over the world. Any disaster in Haiti, in Africa, throughout the Caribbean, Cuba send medical missions to help out. And Cuba is not a rich nation. It is under threat by the US sanctions for over 50 years. That has devastated the economy, but still Cuba is able to provide world-renowned medical assistance to countries that are not under sanctions. Imagine that. That is the strength of Cuba. That is why they are afraid of Cuba, my friends. Imagine being under all that sanctions, embargo for over 50 years, and you're able to produce such a world-class medical program that you are able to ship doctors all around the world to help out third world countries, my friends. If you're watching for the first time, please consider subscribing to my channel, like the video, share it with all your friends and family. The mission of this channel is to bridge the gap between the African continent and the African diaspora. We are one people separated by a brutal European Atlantic slave trade and colonialism. But we are coming back together as one, my friends. We are bridging the gap bit by bit. That is the mission of this channel, and I bring to you videos every day discussing breaking news that affect our people on the African continent and the African diaspora. The African diaspora includes the Caribbean nation islands, Jamaica, Trinidad and Tobago, Guyana, Barbados, St. Vincent and the Grenadines, Cuba, Haiti, the Bahamas, Guadeloupe, Antigua and Barbuda, Martinique, St. Vincent and the Grenadines, Grenada, Dominica, Anguilla, Montserrat, Virgin Islands, African Americans, Africans in the UK, Africans in Canada, Africans in Europe, Africans on the continent of Africa, all 54 African countries, South Africa, Kenya, Ghana, Nigeria, Zimbabwe, Uganda, Rwanda, Burundi, Botswana, Namibia, Mozambique, Lesotho, Eswatini, Niger, Burkina Faso, Mali, Chad, Benin, Sierra Leone, the Gambia, Senegal, Ethiopia, DR Congo, Central African Republic, Egypt, Morocco, Libya. My friends, Zimbabwe. My friends, we are one people separated by a brutal European transatlantic slave trade and hundreds of years of colonialism followed by neo-colonialism. But the mission of this channel is to bridge that gap between the 54 African nations and the African diaspora. My friends, thank you for watching this video. Let me know what you think about this topic of Jamaica's medical system being under threat by US threats of restricting visas for officials if they don't get rid of their Cuban medical program. Thank you for watching this video, and this is Beyond Uncut. My name is Beyond, and I'll see you again tomorrow in the next video. Much love. Bye-bye.